What's going on, everyone? I'm just a typical, average American here today to react and learn about the healthcare system in Norway and how it compares to the United States. Everything I have heard so far makes Norway's healthcare system sound better than the United States. I've only picked up little tidbits here and there about healthcare in Norway. So I'm very excited to hear this video explaining the healthcare system a little better, all at once to me. Hopefully I can understand. I've said this before, healthcare in the United States is a mess. The actual care that you get is good. You can get to your doctor, you can get to the emergency room, the hospital, and they will help you. They'll give you great care. But the whole problem comes in with the finances and how the whole insurance system in the US, where you have to basically make a monthly payment to an insurance company and then hope when you need to visit the hospital that they cover all of the treatment you need. They might or they might not. And then you might go into massive debt and owe tons of money if you need extra procedures or extra help. It's crazy, it makes no sense, and there's no like paying the government through taxes and everyone's covered and gets healthcare. Like no simple solution that we do for some reason, I don't know. So it's good to take a look at the ways other countries do it. So let's take a look. Healthcare in Norway.
My name is Ursha. I live in Norway since early 2021, and today I'm gonna take you on a trip through Norway's healthcare system.
Okay. Oh, is this person actually a doctor?
Nordic region countries are frequently listed as an example of successful national healthcare systems. The Norwegian
Yeah. That's what Americans are always pointing to. The ones who are trying to revolutionize healthcare in America. They're like, look at the way Europeans do it, or Scandinavian countries do it.
Norwegian healthcare system was ranked number 11 healthcare systems. The Norwegian healthcare system was ranked number 11 in total performance by the WHO in year 2000, evaluating the healthcare system in all of the 191 United Nations members.
11th in the entire world in healthcare. How is Norway so highly ranked in so many different categories of everything?
Therefore, and also because one should know the healthcare system of the country you live in, I decided to research and explain a bit the Norwegian one. So let's start with the basics. In Norway, every member of the Norwegian National Insurance Scheme has the right to access the medical services. This means every resident taxpayer gets universal coverage, regardless of the socioeconomic status or area of residence.
This is, first and foremost, like, so great. I don't understand why America doesn't just do it like this, where if you live in America and you pay taxes, which is essentially every citizen in America, you get healthcare access. That's very simple, very effective. A lot of countries do it that way, I think. And the United States is just, it's kind of sad. I don't know.
With one exception, undocumented immigrants would get limited coverage, meaning the emergency acute care. If you are European Union resident through common agreements, you would have the same right and access to medical services as you would have in your home country. Let's talk about structure. All public hospitals are run by 4 regional healthcare authorities. These 4 are Helse Nord or Northern Norway Regional Health Authority, Helse Midt-Norge or Central Norway Regional Health Authority.
Wow, this is really getting specific. I like this. I had no idea it was, obviously I had no idea it was this specific, this information. about the four regions in Norway. Interesting.
Helse Vest or Western Norway Regional Health Authority and Helse Sør-Øst or Southern and Eastern Norway Regional Health Authority. These
Okay.
four RHAs are run by Ministry of Health and Care Services. So the national government is responsible for providing health care according to the goal of, as we mentioned before, equal access to the health care regardless of the economic or social status or geographical location.
Man, exactly. Exactly. Well put. That's what your government should be doing for you, right? That the government is there to help its citizens prosper and be happy. And healthcare is pretty important to being happy. And so it makes sense that the government would make sure there's equal opportunity for healthcare in Norway. That's very good. And makes me jealous, to be honest, because there's a lot of people who struggle with that in the United States. Finding a affordable insurance plan, trying to get one through their employer. These insurance plans only cover certain things that you can do at the hospital. It doesn't cover everything. So you have to pay for lots of medical procedures out of your own pocket. You have to pay for it. Especially the more advanced or, unfortunately, the more life-saving it can end up absolutely ruining you financially. It's horrible.
Most of the hospitals in Norway are public, meaning the state owns and funds them. There are also a few private ones, but they are also mostly funded publicly.
That's a huge problem in the United States, is that a lot of the hospitals are trying to make money. The insurance companies, the medical insurance companies, are trying to make money. There's too much money in healthcare in the United States, where if the companies are concerned with just making money, they're not putting your health first and foremost, which is just pretty sad.
How Norwegian healthcare system is financed. While the availability of public healthcare is universal in Norway and covered by the national insurance scheme, there are some financial stipulations. It has
Okay.
two main funding sources. Number one, the general tax system, and number two, household out-of-pocket payments. About 85% of Norwegian healthcare system is funded primarily by general taxes. Taxation is done by central government, counties and municipalities, and is, if you work for a company, for example, deducted directly from your salaries, the amount being shared by employer and employees.
Okay. I think that's a great way to do it. For some reason, Americans are very hesitant to let the government control a lot of things, which is okay. But if there's anything you would want your government to own and pay for and help with, healthcare would be one of those things that you would want. So really none of it makes sense here.
This covers the most common healthcare services such as GP, mental health care, lab tests and equipment, and drugs falling under the blue prescription system.
Well, this is also a big thing in the United States, where depending on the random health insurance provider you're paying every month, certain things, you might not be able to go to certain hospitals. You may not be able to go to certain treatment centers because they don't accept your specific insurance plan. So that can be a whole thing, just trying to find a place you can drive to and get care based on your plan.
But it's not completely free. If you remember before, I said that 85% are covered by the state, so there are 15% missing to 100. These finances are co-payment and out-of-pocket. Before you mark this system as ridiculous, as a doctor, I would argue that a system like this has its advantages. However, you also have a safety net. Once a person reaches an annual limit of expenses in healthcare, they receive an exemption card. For year 2021, this amount is set to 2,460 Norwegian kroner, which is just roughly 245 euros. After a person reaches this amount, the treatments would remain free of charge for the rest of the year.
What? What? Okay. Yeah, that is completely the opposite of here in America. Wow, you can only spend 200 something dollars and then the rest is free? Yeah, people in the United States can get stuck with $50,000 bills, $100,000, 100,000 euros of medical bills if you have a serious problem. So, yeah, it's hard for me to believe.
Exemption to this rule are children under 16 years of age and pregnant women who all receive free healthcare. So let's have a look at an example. If you would visit your GP, who is a specialist in general medicine, during opening hours, you would pay 212 Norwegian crowns, or just a bit more than 20 euros, for your visit.
I think the last time I visited a healthcare provider, I had to pay like 50 euros, like $50.
Evening, this amount would go up to 332 Norwegian kroners, or just slightly more than 33 euros. If you see a specialist, the visit fee would be 375 Norwegian kroner, and for an X-ray, you would pay 267 kroner.
Yeah, it's funny how everyone calls Norway super expensive. Everything is so expensive, yet the things that matter the most that you need, like healthcare, are very affordable, and Norway makes sure that everyone has access to it. So, yeah, like I said, just another thing Norway seems to be doing right.
So this would be the first part of Norwegian healthcare system and more of its organization and financing. And in the next week's video, I will talk more about getting an appointment with a specialist or...
Okay, so this was like part one of her video. Organization and financing. Well, that's really what I was most interested in. So I liked this. This was actually real good. It's hard to find good explanations of Norwegian healthcare on YouTube, actually. So I found this video, and I'm actually really happy. It explained most of what I was wondering about. This was by Dr. Urza, and I liked it. I gotta give that a like. What do the people say? Are there any comments? Oh, not really. Just people saying it is hard to understand healthcare systems, yes. This basically confirmed a lot of things I thought. I thought the Norwegian healthcare system was better. I didn't know some of the specifics, the specific costs, and how much the government covers and how much is out of pocket, but it all sounds totally reasonable. I mean, there was a big emphasis here on the government makes sure that everyone can get the care they need, and after you spend like 260-ish euros, that's like the maximum you could end up spending. So it's not like in America where you could lose your life savings. It's totally different. It's such a relief, because in the United States, people really are worried about this. It's something people worry about a lot. It's very stressful for a lot of Americans, especially as they get older and they need more care. Healthcare in America is just one of the biggest, just one of the causes of the most stress and anxiety and discussion. And yet, it feels like nothing is really changing. There's so much money involved for corporations that things really don't get changed very quickly here. That's another great thing about Norway, is that they discuss new things and they implement new policies and changes very quickly and efficiently, and it's very progressive. Very admirable. I really respect it a lot, and I'm jealous. America could certainly learn a thing or two. That is for sure. Anyway, if you enjoyed this video, if you enjoyed this reaction, feel free to give it a like or leave a comment. And if you're interested in more videos like this, me reacting to Norway, Norwegian culture, things in Norway that I've never seen or heard before, feel free to subscribe for more. And until then, thanks for watching, and see you next time.